Hi, today's question comes from Kate. She's been recently diagnosed with a low vitamin D level and she wants to know what can she do to boost up her vitamin D. It's a great question, and actually vitamin D is such a critical vitamin that I'm going to expand this video not only talking about what she needs to do to increase her vitamin D, but really give you an overview on the symptoms of vitamin D deficiency and also why vitamin D is so low in this country. Vitamin D deficiency right now is an epidemic. Over 90% of the population have been shown to be low in vitamin D according to some scientific studies. That's tremendous. And vitamin D, although I say vitamin D, it's not just a vitamin, it's also a hormone. Hormones have receptors, and there are receptors that are activated by vitamin D. And that shows that it has not only some metabolic functions to the body, it has tremendous impact on so many different things. So, number one, let's get into some of the symptoms you can have if you have vitamin D deficiency. Immune dysfunction. The vitamin D is critical for a proper immune system. Some scientific studies show that cancer will increase with a lower level of vitamin D. It also has a negative impact if you are deficient in vitamin D on diabetes, cardiovascular disease. It affects obviously bone density because vitamin D is critical to help calcium absorption. And vitamin D is, even when you're deficient, can even have an impact on your mood. Depression increases with vitamin D deficiency. So vitamin D is so critical because it affects so many aspects of your life. Even muscle pain can be increased with a vitamin D deficiency. And that's why most people who go to the doctor, they find out that they have vitamin D deficiency. They're not going there looking for that because their symptoms are kind of amorphous. They have muscle pain, or they have some fatigue, or they're getting sick more often. And doctors are not thinking, oh, let's check your vitamin D level. It's just on a routine panel, and that actually could be the main cause of a lot of those symptoms. So vitamin D deficiency is critical because it could affect so many things. Now, why are so many people deficient in vitamin D? Number one, people are inside much more often than they used to be. Staying inside prevents us from going outside and being in the sunlight. Sunlight hitting our skin increases vitamin D synthesis. So if we're inside a lot, if we have jobs where we're indoors, or if we live in a northern hemisphere, whether it's in upper United States and Canada or northern Europe, that's going to impact how much sunlight we get, and that's going to impact our vitamin D levels. The second thing is bisphenol A, also called BPA. It's found in canned foods and hard plastics. BPA has been shown to decrease vitamin D synthesis. So if you are someone who has a lot of canned foods, whether it's canned beans, drink from plastic bottles, if it has BPA, that's going to diminish your vitamin D count. So what you're putting in your body, even if the food itself seems healthy, because it's in a can or a plastic bottle that has BPA, that actually can have a negative impact on your production of vitamin D. So stay away from canned foods and stay away from plastics that have BPA in them. The third thing that could affect your vitamin D synthesis is your liver function. The liver is critical at producing vitamin D. You need a healthy liver to have a healthy vitamin D level. So people who have a sluggish liver or their liver function is a little bit off, they can have a decrease in vitamin D synthesis. So those are why vitamin D levels may be low. And now let's really talk about basically how can we boost the vitamin D. Number one, get more sunlight. Number two, stay away from the BPA from the canned foods and the hard plastics. Number three, make sure you have a healthy liver. Now, I did a video recently on how to have a healthy liver, how to reverse fatty liver disease, and basically it's really keeping a nice clean diet, stay away from conventional meats and dairy foods, Make sure you're having lots of fruits and vegetables. If you're getting meat and dairy, make sure it's from grass-fed sources. Wild caught fish versus farm-raised fish. Stay away from processed grains and sugars, and stay more with sprouted grains. And those are some food choices. Other things for the liver are choline, and 3 herbs that I recommend are turmeric, dandelion, and milk thistle. Now, the last thing that you need to do to boost your vitamin D level is just take a good vitamin D3 product. But here's what's critical, super important to know. When you are supplementing with vitamin D, and make sure it's a D3 product, not a D2 product, make sure you're also taking vitamin K2. Now, when you take D3, you're helping absorb calcium, which is great for you, but your body needs extra K2 to take that calcium to put it into the bones. If you don't have enough K2, then the extra calcium in your system can actually be detrimental to your health. So, when you're taking a D3 supplement, make sure you are also taking a K2 supplement. Now be sure it says K2. This is not your regular clotting vitamin, vitamin K. K2 is completely different than that. It has nothing to do with clotting, and it helps calcium get put into the bones. Now, what you want to shoot for is somewhere between 1 and 5,000 IUs of vitamin D3 when you are using the supplement. On the higher level, depending on how low your vitamin D status is. So that's everything you need to know about vitamin D. It's a critical nutrient. It's a hormone. There's different things that can decrease its production, and it has a lot of effects on many aspects of the body. So focus on boosting up that vitamin D and start feeling really, really good. If you have any other health questions, obviously, always feel free to reach out. I hope you have an amazing day.